Health service organisations know that assessment of the second edition of the National Safety and Quality Health Service Standards began in January 2019. A number of changes were introduced in the second edition. Included in these changes is the need for health service organisations to implement relevant clinical care standards developed by the Commission. This includes the colonoscopy clinical care standard. Its implementation is mandatory for all organisations performing colonoscopy. The Commission has released an advisory setting out the roles of health service organisations in implementing the standard and assessors reviewing compliance to the standard. As an assessor, you have an important role in ensuring the organisation has fully implemented its responsibilities set out in the colonoscopy clinical care standard. I want to talk to you about three areas of particular importance: certification and recertification. Practitioners undertaking colonoscopy in an organisation accredited to the National Safety and Quality Health Service Standards have to hold certification of their training as well as participate in recertification every 3 years for their ongoing competency to perform colonoscopies. A conjoint committee conducts certification. This committee is responsible for recognising training in gastrointestinal endoscopy. Physician colonoscopists, also known as gastroenterologists, will generally hold certification because it was part of their fellowship training. Surgeon and general practice colonoscopists are less likely to hold certification as the required training was not part of their specialist curriculum. These practitioners will need to obtain certification. All colonoscopists must participate in recertification processes every 3 years to continue to be eligible to work in an organisation accredited to the national standards. As an assessor, it's your role to check that certification and participation in recertification is part of the appointments and reappointments process for colonoscopists. Ensure that organisations check their doctors performing colonoscopies, hold current certification, are enrolled in the Gastroenterology Society of Australia's recertification program, and are meeting the requirements for recertification. You must also ensure organisations are regularly presenting indicator data for colonoscopies by a practitioner at clinical review meetings and routinely reviewing colonoscopy results and practitioner performance at their Medical Advisory Council or equivalent body. Nurse endoscopists may also perform procedures. For this workforce group, assessors need to ensure organisations are routinely checking that nurse endoscopists hold current certification and are engaged in the recertification processes specified by their jurisdiction. Informed consent. Obtaining informed consent is a legal, ethical and professional requirement in Australian healthcare. Informed consent is a key requirement of implementing the colonoscopy clinical care standard. This involves discussing the risks and benefits of the procedure with the individual. Informed consent is a person's voluntary and informed decision to agree to a healthcare intervention, treatment or procedure. For there to be valid informed consent, the patient must have the legal capacity to consent, provide consent voluntarily, provide consent in respect to the treatment, procedure or other intervention, be adequately informed when making the decision to consent. A patient gives informed consent for a colonoscopy before commencing their bowel preparation. It is not uncommon for patients to be referred who do not have an opportunity to discuss their procedure with a colonoscopist before commencing their bowel preparation. In some cases, the health service organisation supplies the bowel prep. The Commission expects assessors to review an organisation's processes for informed consent to ensure it commences prior to starting bowel preparation. This informed consent discussion can occur in person or over the phone. In all cases, assessors should ensure patients are provided with appropriate written information on their colonoscopy preparation and procedure. A discussion is held with a suitably qualified clinician. A qualified clinician could be a nurse or a medical practitioner. The clinician assures themselves the informed consent meets ethical and legal requirements. A written consent document is signed by both the patient and proceduralist prior to the colonoscopy commencing. A copy of the signed informed consent document is filed in the patient's healthcare record. Informed consent discussions should include prompts for the patient to ask questions, provide information on the risks and benefits of the procedure for the patient and alternative investigation or management options. Seek information on the patient's comorbidities, medications, previous relevant investigations. Include a discussion about any changes to the patient's medication that may be necessary. Outcome of the procedure. It is a requirement of the clinical care standard that patients are provided with adequate verbal and written information prior to discharge from the health service organisation on both the outcome of their procedure and follow-up plans. Your responsibility as an assessor is to ensure the health service organisation is documenting colonoscopy findings, outcomes and follow-up plans in the patient's healthcare records. A report on the procedure from the colonoscopist needs to be provided to the patient's general practitioner, other treating practitioners and the health service organisation. These reports should, as a minimum, include information on the indication for the procedure, date of the procedure, quality of the bowel preparation, extent of the procedure, findings and their management, histopathology, the follow-up plan, and if required, the recommended timing of a future colonoscopy. And finally, assessors should ensure that completed reports are filed in the patient's healthcare record. Relevant information is available on the Commission's website, including the requirements of the National Safety and Quality Health Service Standards, the Colonoscopy Clinical Care Standard, the advisory for implementing the Colonoscopy Clinical Care Standard, the certification and recertification fact sheet. The Commission's website can be found at www.safetyandquality.gov.au.